Some advocates for drug policy reform would like to see the entire system of drug regulations torn down so that we can start again from a blank slate. I can see the appeal of this. Such a system could be evidence-based and ideologically consistent. But given the current attitudes of lawmakers and the public at large, this is too much too soon. Too extreme to be credible and possibly counterproductive in the long run. The Beckley Foundation shares the final aim: drug policy which is centred on harm reduction, which treats drug use as a health matter rather than a matter of criminal law, and which, at its completion, would see the legal regulation and sale of drugs not unlike how we handle the sale of alcohol and tobacco. We want to see drugs regulated, not because we think they aren't harmful. All drug use carries risk. But we want to see drugs regulated because they are harmful, and the best way to manage the risks involved is with levels of oversight appropriate to each drug. In our upcoming policy reports, Roadmaps to Regulation, we outline the options and best, most harm-reducing routes to regulation for cannabis, MDMA, the psychedelics, and new psychoactive substances, with different recommendations in each report to account for the different patterns of use and risk profiles associated with each drug. Instead of taking the shortest route to legal regulation, the Beckley Foundation advocates for a phased change in the law, with natural points along the way to pause, take stock with a systematic collection of evidence, and steering the course of regulatory changes in response. Each step follows the best available evidence and is designed with the aim of maximising the net benefit to society, minimising the health risks associated with drug use, especially among young people and other vulnerable groups, minimising the social and economic costs of drug policy and its enforcement, decreasing the income fueling criminals and minimising the social harms that come from their markets, encouraging less harmful modes and patterns of consumption, and harnessing the significant therapeutic potential of these currently illegal drugs. The rescheduling of these drugs, easing the restrictions on scientific research, is an obvious first step that everyone from across the political spectrum should be on board with. Whether these drugs remain forbidden or become legalised doesn't change the fact that millions of people are drug users. The more research we can conduct into these drugs, the better. Moreover, the current evidence suggests that cannabis, LSD and psilocybin, MDMA and other Schedule I compounds could be particularly effective treatments for a number of mental and physical health conditions. By moving them to Schedule II, we can learn much more quickly what therapeutic benefits they could bring. Decriminalising drugs for personal use, that is, removing criminal penalties for possessing small amounts of drugs, has worked wonders for reducing drug harm in Portugal. When Portugal decriminalised possession in 2001 as part of a shift towards a health-oriented drug policy, opponents were quick to call the move unworkable. They warned it would lead to a rampant increase in drug use and addiction. It did not. They warned that Portugal would become a haven for drugs tourism. It did not. They warned that drug-related crime, theft, drug sales and prostitution would increase. It did not. Instead, the most reliable measures of drug use have decreased. Drug-related deaths have decreased from one of the highest in Europe to one of the lowest, and the numbers entering treatment for addiction are higher than ever before. Under decriminalisation and a health-oriented drug policy, problematic drug users who want to quit can feel confident about seeking out the help they need without incriminating themselves. Those on probation, for example, can access support without first having to admit to an offence. Although decriminalisation for personal use alleviates some of the harms associated with current drug policy, it shouldn't be the end goal. The billion-pound market would still be in the hands of criminal enterprises and gangs, fueling violence, people trafficking, and other totally damaging social ills. By regulating and overseeing the production and sale of drugs, we can deprive criminals of this money and ensure drug users have access to clean, unadulterated products with precise information about strength, covered with health warnings, much as we see for tobacco and alcohol. By taxing sales, we can fund proper drug education and treatment programs, with much more left over for the public coffers. And by restricting sales, we can minimise use by young people. In a good number of areas, teenagers find it easier to acquire illegal drugs than alcohol because drug dealers don't ask for ID. The fact is, there is no link between the severity of a country's drug laws and the prevalence of drug use. This may sound controversial, but it is not up for debate. Study after study after study has failed to find such a link. The UK government's own International Comparators report came to exactly the same conclusion. A conclusion which Theresa May, then the Home Secretary, tried to have changed because it didn't sit well with a tough on drugs ideology. The one fact that the public and legislators need to wake up to, and thankfully many are waking up to, is that reducing the amount of drug use is not synonymous with reducing the harms that come from drug use. Countries like the UK, where prevalence of drug use has remained stable or decreased, the fact that drug deaths have reached the highest levels since comparable statistics began demonstrates that reduced prevalence of use is not a good indicator for reduced drug-related harms. In the UK, drug-related emergencies have increased every single year since 2008. Our drug-induced mortality rate is 3 times higher than the European average and 10 times higher than Portugal. We need to stop trying to minimise drug use and start trying to minimise harm.